So first, let's talk about what narcissism really means. Narcissism isn't just being confident or needing space. And when we talk about narcissism, we're talking about a component related to narcissistic personality disorder. And when we talk about narcissistic personality disorder, now these two components are obviously confused. Narcissism is very egotistical, very self-centered. You don't consider other people's feelings all the time, things like that. And it also has a strong component of entitlement. Now, narcissistic personality disorder. Now, this is where it is much more complex. It is a combination of a variety of symptoms and traits. And this is typically where someone lacks empathy. So it's a higher degree of just narcissism, when we're talking about here. Also, they need constant praise all the time, admiration. Yes, you're good. Yes, you're great. Yes, you're the best. All this other stuff. And they refuse to take responsibility. Whereas narcissism, you're going to see some of that, but it's not to the extreme level of narcissistic personality disorder. So here we have more traits, some subcomponents, and here we're talking about the full disorder, the full complexity, that it is a way of life and an approach to how you see yourself, others, and the world around you. And if it's a little confusing, it is confusing to a lot of individuals, even some mental health providers, because often when they see traits of narcissism, sometimes they jump to narcissistic personality disorder, but that's not accurate. We don't want to do that because treatment and prognosis is very different. For individuals with narcissism, it is a higher prognosis. It is a higher probability of being treated in fewer sessions, whereas narcissistic personality disorder is going to take a lot longer because it is about really changing those internalized beliefs, behaviors, and patterns, as well as adjusting those maladaptive narcissistic belief, behaviors, and patterns to more adaptive patterns. Your narcissism, these individuals probably have some adaptive capacities and functions, so we can tap into those in treatment and really help these individuals to do things differently and separate their ego, their sense of self, from how they're seen by others and how they relate to others. Now, narcissistic personality disorder is rare, and it's very different from when you are setting boundaries, when you are feeling overwhelmed and need to kind of step back a little bit. And it's even different from when you're feeling strong emotions. And that's what we're really talking about here, is that when someone calls you a narcissist, they may be misinterpreting you and not fully understanding the issues and concerns that you're contending with or where you are emotionally, cognitively at that moment.